So I think we are live now, Aaron. So before today, I know we're going to be talking about something really, really important with our health disparities among African Americans. But before we do that, we like to start the show off by just basically kind of talking about different things that are happening at Roberta's house. So do you want to bring us up to date with some different things that are happening, some new things that are upcoming with Roberta's house?
Sure. I am Aaron McCracken. I am a homicide survivor advocate at Roberta's house. I am with the Homicide Survivor Advocacy Program. We are here to help out the community when they're dealing with grief, when they've lost a loved one to a homicide. Some things that are going on, we are starting a male grief group at Roberta's house. It will be starting soon, this Wednesday. If you know a gentleman who is struggling with grief, or if you yourself have a couple of questions about some men that may be going through something in their lives and you don't know how to approach them, please join us Wednesday at 6 o'clock. We will be taking questions, and we're having a forum of some gentlemen who are going to discuss some topics, and that's going to lead into our grief group that will start very soon. So we are taking applications for that group. So if you are interested, please join up, and we'll be able to assist you the best way we can. Again, that's 6 o'clock on Wednesday. The male group will be on Roberta's House's Real Talk, having a Q&A and a roundtable discussion, and that will segue into our male group that is going to start in a couple of weeks. Some other goings on at Roberta's house. There's a fundraiser coming up. In lieu of our crab feast, which was canceled among many other activities this summer, we are having a Grab Crabs and Go fundraiser on August the 8th from 1 to 4 at Roberta's house in a parking lot. That's 2510 St. Paul Street. The proceeds benefit the programs that many families have come to know and love and use on an everyday basis here at Roberta's house. Order a dozen, half bushel or a bushel of crabs with a side of ear of corn for you and the family to take home with you. Details can be located at Roberta's House's website. That's robertashouse.org/events. So please come out, get some crabs, get some good food, meet a couple of the workers here at Roberta's house. We'll be back with hopefully next summer, we'll be able to have the real thing again. But right now, this is our way of being able to continue that tradition, which has been the crab feast. Also, Roberta's house, having a brand new building that looks amazing, being constructed right now on North Avenue, 900 block of East North Avenue. So to celebrate that and to celebrate your loved ones, we are offering you a chance to buy a brick that will be located on the property at Roberta's house. So if you've been through the program with a loved one and you want to honor them in any kind of way, please buy a brick. There is a donation of $150 or $300, and you can put a down payment on them in case you don't have everything at one time. But we have till the end of the month to do that. But it's a great way to memorialize your loved one and to keep their honor going. Nothing would be better than for you to come by Roberta's house just to chat and see your loved one's name and be able to speak with them and see them every chance you get at Roberta's house. So I think that would be a great way for you to celebrate your loved one and their tradition and what Roberta's house, what we stand for. What we stand for is to help those heal through their grief journey. And what way to do that than to see a loved one on your journey into the building. So I think it'd be a great opportunity for you to have something connected to that person you've lost.
That's great, Aaron. So did you say the cost is $150 per brick?
So I was saying $150, and then I was saying or $300. So there are two different types of bricks that you can do, and depending on what you're getting inscribed on it. But both bricks, no matter the price, you can put a down payment on and not have to pay the whole lump sum at one time, which I think is great, especially with these times where you're not able to get a full paycheck due to coronavirus. So please take advantage of that if you are able and have the chance to.
Yes, that sounds awesome to be able to do that. I'm sure that there may be a lot of people who will be interested. Hey, so Vicky just joined us. Hey, Vicky.
Hey, Paulette. Let me ask you a question. Am I too dark? I can go downstairs.
No, you're fine. So you're on live now.
Oh, okay.
So we're kind of going through some of the different things that Roberta's House is offering. So we're going to keep talking.
Okay.
Erin was telling us about some special things that was happening at Roberta's House, and one of them was the crab feast. So you didn't get a chance to hear it, and I don't know if William had a chance to hear it. So can you go over the crab feast one more time? Our crab feasts at Roberta's House are awesome. The crabs are the best. And normally it's a big to-do. There's a lot of dancing and coming together. It's more food than just crabs. But this year we're going to do things a little bit different due to COVID-19. So Erin was sharing that with us. Erin, can you go back over that again?
Sure. In lieu of the crab feast, which has been a great staple of Roberta's House's fundraising and a great staple of the summertime, we're doing a Grab, Crabs, and Go on August the 8th from 1 to 4. So we're going to have it on our premises at Roberta's House, 2510 St. Paul Street. You can order a dozen, half bushel, bushel of crabs, and come by and pick them up on the spot. They'll be cooked on location. The gentleman is coming from the Eastern Shore, so you know the crabs are going to be good and well stocked. So come by and celebrate Roberta's House, donate to a great cause, and take some food home.
All right.
Great. That sounds great.
Yes. And Erin was also sharing with us about a new men's group that's offered at Roberta's House. I think they started it last week, at least an orientation into the men's group. And this kind of ties into what we're talking about today as we talk about health disparities among African Americans, barriers to African American men, accessing healthcare itself, and some of the different things that happen with African American men, and whether or not they're following through with getting back and forth to the provider. Because I know for me, my husband, I have a hard time to make sure that he gets his physicals once a year. Sometimes that's not what he always wanted to do, but Erin's going to tell us a little bit later about his experiences and what that looked like. So, and I think some of these things will come out with the group process. So Erin, could you share with us again about the group, the men's group? I think the men's group are going to be something new for Roberta's House. And I think it's going to be an awesome group, particularly when we get the males involved. So how are we getting men in our community involved in this group and getting that information out, Erin?
So what we're trying to do is this Wednesday, we're going to have a guest come on. He's from the 21217 zip code, that area, and which has his own issues and challenges. And he's going to come on and speak about what the men in that community, or the community itself, or what they're going through. And what this group is supposed to do, what we're going to do. We're going to address male grief, and we're going to address the stereotypes of it. We're going to address the underlying conditions that come from it. We're going to address the health implications that we'll talk about some later on with me, but also some things that you may not know that you're doing that stem from grief. And we're going to discuss how grief is not just associated with death. You can grieve in various ways, and it's a big misnomer that in order to grieve, somebody had to die. That's not true.
So I think that's what we're kind of experiencing right now due to COVID-19, is that there are other type of disenfranchised loss. So it's not just always associated with death, but there are other things that we're losing, particularly when we look at employment or unemployment services as we work with our young men. And we know that that's been an issue all along sometimes for our population of men that we provide services for, is connecting them to resources, particularly with those who need employment. So can you talk a little bit about some of the topics that you will be presenting with the men?
So this Wednesday, we're going to discuss various topics. Black Lives Matter. We're going to discuss disenfranchised grief. And we're going to discuss the ability to allow men the room to grieve. But when we do start our men's group in a couple of weeks, we're going to discuss the multiple layers of grief, the causes of grief, and once again, the healthy coping strategies for grief. An important point that I make sure that everybody know, but men need to know also, is that nobody can force you to be over your grief and to tell you how to grieve. Mm-hmm. And you have to allow your space, yourself the space to grieve. So we're going to be doing the Zoom conference when grief starts, and we're going to allow people to call in, and we're going to have a nice open forum for the African American, any male, to join and be able to talk and discuss what they're going through and the barriers they may be facing when dealing with their grief. Not a lot of issues that come from grief are because they're untreated or not discussed, and they're put to the side. So we're gonna delve and dive into all of those things and more. It's going to be a 10-week session. So it's going to be plenty of time for men to come on and keep coming back. The thing is to not just start the job, but to finish it. So don't just come on week 1 and 2, get a couple of head nods, and then disappear. You got to continue working towards bettering yourself.
Exactly. That's a very good point, that this is not just a drop-in session, that this is an ongoing session that we will have open for men to be able to join and to just come and just kind of discuss various topics that are impacting them. And I think you talked a little bit, Ern, about maybe men, and I think maybe I said it, some difficulties with men being able to open up, particularly as it relates to grief. So from your perspective, I know you're a young man. What does that look like for men on opening up and talking about grief, talking about the pain that they have within?
Well, so as we discussed last week on a Real Talk, one major issue is the facade of what a man looks like when he grieves, and that a man can't cry, shouldn't have emotions. They have to just move on. And to me, that's a big deal. That way, where the entire family's issue has to fall on him. Mm-hmm. And that causes unnecessary stress, unnecessary grief. We take on so much that is because a burden to us, and it shouldn't be our cross to bear. So a lot of issues that we have, sometimes we put on ourselves. The pressures of making sure your family is taken care of, the food is in the house, that your children have the best tennis shoes. Like, so much that we put on ourselves. And then when you compound that with what society puts on us and how they view us, it's really a recipe for disaster if it goes untreated. Yes,
I agree. Thank you, Aaron, for sharing that. So we're going to get started. So we are live. So we were just kind of going over some different things, what's happening at Roberta's house. And Aaron was sharing with us the men's group, the new men's group that we recently started. What's the name of it, Aaron?
MOLD.
MOLD. And what does MOLD stand for?
So Mr. Gregory came up with the acronym. Came up with the acronym, yes. I believe it's Men Over Love and Dedication, I believe, but the gist of it is we're molding young men to become better. And yes, and that's the focal point of the group, is to, and never just young men, but men, period. Because even, you can't think the old dog new tricks is not true. Right. Everybody can learn from different experiences shared by other people.
Exactly. Thank you so much, Aaron, for sharing that and sharing some updates that are happening at Roberta's house. So we're going to go ahead and get started. My name is Dr. Tillery. I'm the director for the Homicide Survivor Advocacy Program at Roberta's house. And welcome to another Real Talk session live with Roberta's House. So I'm excited today because we're going to address a very important topic, which are health disparities among African Americans with a focus on African American men. So I'm really excited too about our guest today. We have Miss Vicki Jones, who's a care coordinator with Privia Health. Welcome, Vicki.
Thank you.
We also have Mr. William Kellebrew. He was the Director of Youth and Trauma Services through Baltimore City Health Department. Welcome, William.
Thank you.
Thank you guys for joining us. And I'm gonna, and of course we have Aaron. Aaron kind of started off, and he's one of our survivor advocates with Roberta's House under our Homicide Survivor Advocate Program. So I guess I'm going to start off with Vicki. Vicki is a registered nurse. And so Vicki is working with different individuals who are impacted by some type of health disparity, particularly African Americans in general, because that's our conversation we'll talk about. So if I can start off with Vicki, can you tell us a little bit about who you are and what you do?
Okay. First of all, welcome. Thank you for having me. I'm honored to even be live and to help support your organization with what I have to bring to the table. My name is Vicki Jones, as was said. I'm a care coordinator, case manager with Privia Health. I deal with a lot of patients as far as case managing diabetes, hypertension, increase in blood levels off the hook, just out of whack. All different types of resources, medication resources, insurances. A lot of people don't have insurances, so they don't follow through with coming to the doctors or going to see a provider. The ER is, for us, is considered as a revolving door because they don't have the resources that they need to get insurance to get them the care that they need. But what I do is try to close that gap with assisting them into meeting that, getting that on point. So that's a little bit about what I did.
Yeah, sounds like some important work. Thank you, Vicki. Now, our nurses and doctors have been, over this COVID-19 situation, have been our heroes because they've been out there and working hard and spending a lot of hours and really trying to work with individuals who've been impacted by COVID-19. So thank you, Vicki, for your service. So now I want to go to Mr. Williams. William, can you tell us a little bit about what you do, who you are, how long you've been with the Baltimore City Health Department?
Yes, thank you also for having me on, Dr. Williams, and also hello to all of our guests and to all of my fellow panelists today. So I've been with the health department since 2016, been directing their Office of Youth and Trauma Services, and we are primarily focused on serving young people and their families. We do have elements of our programs that focuses on serving victims of crime, anywhere between the ages of 11 and 24. And also we do focus on trauma training and addressing trauma and violence. Now, we have an upstream approach. Formerly, I think about over a year ago, Safe Streets was actually in our office, and they were moved by the mayor, then Mayor Catherine Pugh, to focus on the violence reduction initiative within the Mayor's Office of Criminal Justice. And so we thought it was important to focus on an upstream approach, our public health approach, and so that's what we're doing today. We have 3 violence victims of crime programs that are federally funded, state funded, and we have and we're actually focusing on the Healing City Act, implementing the Healing City Act, which focuses on a real systemic or systems change within the Baltimore City agencies, but not just the agencies, really looking at a cultural shift for a city.
Wonderful.
So where we are.
Thank you. Thank you for sharing. So with our topic today, as we talk about health disparities among African Americans, and particularly African American men, and looking at why is there a reason why African American males don't reach out for help? All right. We talked about whether or not they talk when it comes to grief. We want to talk a little bit. I'm going to involve William in talking about the trauma that African Americans are faced with. And I want to start with Aaron. I want to go back to Aaron. Aaron is one of our survivor advocates and works with homicide survivors at Roberta's House. And I want to just talk to him a little bit about health. Aaron shared with me earlier about him being a young man and having a heart attack. So I wanted to kind of, if you could take us back, Aaron, on what that looked like, what it felt like, and particularly being so young and having a heart attack. And we associate heart attacks with people that are middle age or older. It is rare when you hear about a heart attack with a young person. Can you tell us what that looked like, and were there any warning signs?
So yeah, sure. So I was 32 years old when it happened. It was weird. I wasn't feeling well on a Tuesday, and what happened was my girlfriend gave me some medicine, but it was cherry, and I'm allergic to cherry medicine. So I ended up throwing up the medicine. After that, my chest was tight. But I associated the two being my muscles were just locked up from, throwing up. So I didn't think that it was anything with my breathing. For 2 days straight, I called out at work. I took 500 milligram Tylenol, and the pain in my chest just would not go away. I didn't go to the hospital till Friday. Mm-hmm. So for the better part of a week, I was suffering from a heart attack. I went to the hospital, and the guy ran some tests, did the blood work, and I will never forget it. I was right in front of the nurses station, and the doctor went to the crew in the nurses station, and they all turned and looked at me at the same exact time. Hmm. And he came in and told me that I was having a heart attack. And I just know tears just flew. It was really scary. The pain, the pain went out the window. It was just, now it's like, am I going to make it now? So what happened was, I was at St. Agnes. They put stents in. The stents weren't doing the job. So I was transferred to St. Joseph's, where I had open heart surgery, and they took artery out of my, not artery, but they took out my leg. I think it was an artery. Yeah, and they put it in my heart. And and I got this scar here that my daughter looks at and keep asking me what's that and everything. It was a really scary time. I was in the hospital for a week. While in the hospital, I was diagnosed with diabetes. Came home and recuperated in the house. My girlfriend had to go to work. This is before my daughter now, our daughter. She had to go to work, so I was at home till 6:30 sometimes by myself. My insurance wasn't the best, so I didn't have a fancy doctor at home to prop me up and help me out. So, I recovered pretty fast because I had to. I think that's a big thing too, is that we as, the poor, we can't even recover correctly because there's the pressure of getting back to work because our job wants us back in. They'll give the initial, we feel sorry for you, but then, when are you getting back here? And then I had to know that, if I don't get any better, I'm just gonna be sitting in this bed. I had to get up and be able to take care of myself. So it was a long, I want to say about a 3-4 month journey of changing my lifestyle so I can continue to be here. Yeah.
That sounds awesome. Like scary. Yeah, it sounds like a scary, particularly more so for a young man. So I'm so glad that you recovered from that. And we'll talk a little bit later how that has actually changed your life, and as far as the decisions, the behavior changes that you've had to make. So Vicki, would this sound familiar? Does all this sound familiar, particularly as he covered a lot. He covered individuals who having a heart attack and not knowing they're having a heart attack. He also talked about being diagnosed with diabetes. He talked about the lack of insurance or accessibility insurance and having to return back to work so soon. When your world has stopped, but the world is saying you have to get back in here. You have to keep it rolling. So does this sound familiar with some of the patients that you work with as it relates to health disparities?
Yes, it sounds very familiar. A lot of the patients don't know the resources afterwards to get, back into the work field and workplace and stuff, even though the work field and workplace environment wants them to come back, and don't know the nature of what they were diagnosed. Like Aaron had a heart attack. It could be as much as somebody with extreme high blood pressure that has to be out for a few days, or diabetes that had to be monitored and balanced out. So a lot of times, like he said, they was rushing to get back. He didn't have the best insurance, and that's another big piece of it. It seems like the hospital sometimes, because a lot of people don't have the best quote unquote insurance, they kind of get left behind, but they still have to care for them. So a lot of people get in their minds that, pretty much they don't want to follow through with the routine of their diagnosis and things like that, or their care, because they're trying to get back to work. So it's like, I have to get back to work. I can't do this right now, but I'm well enough to get back to work when they really aren't. So yeah, it ties into, that's a big piece of it, rushing and getting back.
So what are some of the health disparities that you see primarily among African Americans? I know he talked about diabetes.
Mm-hmm. Yeah, diabetes, hypertension, lack of insurance is a big problem, and it's between females as well as males, but males in particularly, because they just won't do it. As women, we will go first if something happens, whether or not we have insurance or not. Males is a little bit harder to pull through, but it's the lack of insurance is a number one factor of it, and then all the other chronic illnesses fall in between, in underlying with the insurance piece of it.
Mm-hmm. So do you see a lot in your line of work, the chronic illnesses that are facing young African-American males?
Yes.
Or is it primarily for middle-aged to older males?
Now, I'm going to talk a little bit about that. It's sort of flipping the script in this day and time. It used to be where we would look at our aunties and uncles as being older or older in age, that has the heart attacks, that have the diabetes, that has the hypertension, that has this and have that. But now it's flipping to, like as Aaron said, he's young, it's flipping to the younger generation. Mm-hmm. And that's the concern that we are having and trying to deal with now in this day and time, mainly is to get the younger generation to be compliant and following through with their ailments, whether it's insurance or hypertension or diabetes, get them on a regimen where they know they can to survive if they just get on a regimen was taking care of themselves.
Yes, and see, that's one issue when we talk about disparities among African American males. So what would be some other disparities as it relates to maybe you face being an African American male, young male?
Well, the problem of being a young male is that, or being young period, mm-hmm. is that you always have tomorrow. So mm-hmm. when you're eating the crap you put in your body, mm-hmm. you think that tomorrow you'll just work it off, mm-hmm. and tomorrow you get it fixed, not knowing that the continuous use and the continuous digestion of this bad food is what's killing you, mm-hmm. and you don't even realize it. We did during my internship, we had a survey. We would ask, teenagers about the food they ate, and if there was a bar graph, Cheetos and all that other stuff is up here, and vegetables and fruit was down here, and McDonald's was up here, fresh cooked food was down here. So, and when you go into our local corner stores, that's what you have right in your face, are the junk food right there accessible to you. So when you put that smack dab in the middle of the Black community, and it's affordable enough for them to buy, and it's a quick meal to get home, that's where the disparity comes in at. Where we don't have any yogurts in our corner store, we don't have celery stock to buy, we don't have the good vegetables and the better choices. We have the Smack cereal and the Little Debbie's and the Takati's, things what they call now, Takis, what the kids eat now. Like those are right there. So that is the options that we have. Also, look at our supermarkets versus how many Black people go to another county to go to the market because the African American markets are substandard. Mm-hmm. And we don't put a voice that enough. You know, the vegetables that we get are bruised and soft, and in a couple of days are rotted. Where we take a half an hour trip to Howard or Baltimore County, and the vegetables and the fruit are just a different color. You know, they just have a different life to themselves. So there are many disparities that we don't even recognize that are being forced upon us due to this systematic injustice that we've been writing about for the last 2-3 weeks. You know, it's more to it than just there's more to it than just us going outside and selling drugs or whatever.
Mhm.
Like there are things in our own community that we don't have any control over that are poisoning us and that aren't as up to standards as our Caucasian counterparts.
So what would you say, because I'm going to bring William in on this, about the trauma? You're working with individuals who are survivors of homicide. And so I know that every time there's a male that comes to our program, the first person we call is Aaron. So Aaron, what are you seeing firsthand when it comes to trauma when working with some of these young men?
Layers. As Shrek was saying, he's an onion because of the layers. Layers. It's grief on top of grief. I had this friend die, this cousin died. When I was younger, I was left out on a porch by myself. It's so many things that you have to unravel in a conversation. And you sit there and go, no wonder you're so upset, and no wonder you're sick, and no wonder you are taking your anger out on everybody in the world, because you have all this built up and you told to nobody. You know, I'll say there's several men, you know, who do you speak to? Nobody. There's too much pride to talk to their wife, and they're too proud, and let alone as having a man cry in front of another. One of my close friends yesterday was visibly upset, and he had to walk out my house because he didn't want me to see him cry. And I've known this man almost 20 years, and they still have that machoismness, whatever that word is you want to use, that I can't show my emotions to my best friend. It's disheartening. You know, yes, sir, Mr. Sir William. It's a killer word, masculinity, but I like the macho-ness of it. You know, it's just that being a man.
Same thing.
It doesn't matter who we're in front of. It could be our best friends, and one teardrop, and we're not a man no more. And we have to get rid of that falsehood that we lose our masculinity just because we show emotion. And why is it only when we win a championship we can cry?
Right.
So it has to be other avenues that we can get our emotions out other than winning a championship. You know, it's a lot. But the thing is, we hit our A scores. We hit that childhood, you know, adversity at such a young age, and we don't deal with it, and we learn to not deal with it. So as obstacles hit us, we know how to deflect, we know how to sink it in, we know how to treat it with drugs and alcohol, we know how to beat up on our friends and shoot each other and beat up our girlfriends and our children, but we don't know how to say, I need help. And that's the whole thing of this. We aren't raised to know how to say, I need help, I need to talk to somebody.
Thank you, Aaron. Thank you for sharing that. So William, I know you worked with a lot of young people who have suffered various forms of trauma. I think I've heard little of your story when it comes to trauma in the past also. So how would you say that trauma is impacting African-American males in our community today?
So thank you for that question. You know, how is it impacting? I think that Aaron and Vicky have stated some key points to that, and it you know, one of the things as listening to this, because there's so much going on, so much here to unpack. One of the things that reminded me or that came to my mind is one thing I've said before, and I've even said it you know, publicly in the post, just so I made sure I got it in there to coin this term. But I believe that trauma is the germ of the 21st century. It's something that we can't see. It's something that we often don't see, but it manifests itself. We can see the signs, we can see the symptoms, but we don't see the the actual pain that's inside somebody, just because we just don't know. You know, trauma is an individual experience, and no two people will ever go through it the same. But there are some things that we can value in understanding the road that people are traveling when it comes to experiencing trauma. And so we get an opportunity at the health department to engage many young people and their families. And we get to see what Aaron talked about, those layers of trauma. I mean, I'm getting tingling feelings thinking about it, because just imagine, you know, the infant mortality rate when we come in, you know, in 2018, we saw at 12% infant mortality rate for African Americans. We were at least 4 percentage points above everybody else in terms of mortality rate. So we come into this world as African American men at a disadvantage. We already come in at that point. So it's a very tough world to live in when you have this. And then you talk about, Aaron, you talk about those options, the access to food distribution, the access to, you know, we're living in these desert fields, or these deserts, food deserts, that we lack the access to food. We lack the access to affordable and clean and quality housing. We lack the access to income. You know, in 2008, and the story's still the same here, when the health department released the data and analysis on the difference between living in 2 zip codes. And we look at Hollands Park, and then we look at Roland Park, and we see, you know, in Holland Park, the life expectancy is 63 years old, but it's 83 years old in Roland Park. So there is a difference in terms of the access. So we're talking about access to healthcare. We're talking about education, access to education. When I looked at the, you know, the graduation rates, I'm looking at 49%. Well, I'm looking at, I got the percentages in my head, but let's say that, you know, our African American young people, and you know what, I actually have, it's very interesting. I just looked up a stat the other day, and I know that our young people are graduating at lesser rates and lesser rates. So the barriers to need are beyond the school, including school and beyond the school, because there's just so much to grapple with and so many layers to grapple with, that the trauma is there. But oftentimes as teachers, as helping professionals, sometimes we don't see it and we can't recognize it. And it's important to realize the prevalence of trauma around us, because when we don't see it and we don't acknowledge it, we can't treat it, as Aaron said. We cannot address it. And so I think that it's important to address those layers, because, well, you know, lastly, I'll put this out there. I'm a little bit passionate here, but lastly, I'll say that we once treated everything in one silo, the same way it was brought to us. And Vicky probably knows this more than I know it. But when patients come to us, we often look at, you know, what's wrong with you, instead of what happened to you, or what have you experienced.
Exactly.
And in fact, the interesting thing is, I have a friend of mine who is a doctor who does it's when you do the therapy, the physical therapy. Therapist, right? He's a physical therapist. And before we talk to him about trauma-informed care, he used to ask his patients, you know, tell me what's wrong. And patients used to tell him, you know, it was my knee, it was my leg. And then he said that he kept on going, instead of a 15-minute interaction with patients, he was going over 20, 30 minutes, and he was staying very late. And I said, so after the trauma-informed approach, he went in and started asking, can you tell me about what brought you here, what happened in this situation? And people would tell him, oh, well, I was in a car accident 2 years ago. He said, well, you know what? That immediately gave him information to get to the root cause, to go upstream. So to me, it's really about, you know, understanding that trauma is the germ of the 21st century, and we often don't see it and recognize it. And then we must go upstream to address it, to prevent further harm and damage.
I agree. It's interesting. Excellent. I was reading a study of, I think W.E. Du Bois did many years, probably 1896. And he went into the 7th Ward in Philadelphia. And so when he started to do some research on African Americans, and it's alarming because the study and the outcomes are, you know, look similar to what we're facing today.
Yeah.
He talked about the health
Yeah.
disparities. He talked about the environmental influences. He talked about the lack of access that we had. So my question is, from 1866, when this study came out, and now we're now in 2020.
Wow.
How do we start to approach in dealing with trauma and what's happening? Because if not, we'll be in 2040, 2050, it will still be talking about the same thing that's impacting African Americans. So where do we start at, particularly, let me come back to Vicki, when it comes to addressing health disparities? How do we start to educate our people on looking at themselves within and, you know, becoming proactive and saying, hey, you're saying I'm diagnosed with diabetes. What do I need to do? How do we start that change process? You know, how do we stop the next generation of individuals who are going to be diagnosed with diabetes? Because this is something, this is intergeneration, it goes on and on and on. So what do we need to start with when we talk about health disparities among African Americans, and how do we address some of the disparities?
Well, first of all, like for example, like you said, I'll go with diabetes. First of all, a lot of our patients, male and female, mainly males. I hate to hop on males, but males are, you know, non-compliant sometimes, for a better word. It's the lack of education. Of course, it's a lack of resources of education, because a patient or a person will walk around not knowing that they have high blood pressure, not knowing, like Aaron, not knowing that he was having a heart attack, not knowing, you know, the signs and the symptoms, just uneducated about it up front. So the things that we do right up front is that once they're diagnosed, is to give them those educational resources right off the bat. You need to read about it. You need to read up on what's happening to you, you know. So that way we try to get the patients to get a full understanding of it so that they can tell the next person, like, girl, and you do a lot of the older patients, you do hear them saying, girl, because when I was diagnosed, I didn't know, but I'm telling you, that's not good for you. And that's good to know that they are sharing once they are educated about, you know, about the illness or whatever they're diagnosed with. So it's the educational piece is a big piece in what we do in the office. That's a big piece of it, to get them educated on it. So that way they can maybe tell somebody else once they're compliant. You know, that helps us out a lot with education resources on the illness.
Yeah, I'd love to add to that, Paulette. One of the things that, so when you asked that question, was really interesting for me. When we talk about, you know, health disparities and we define health disparities, there's been something happening that's been different in some unjust way. And when we think about the CDC's or the Center for Disease Control's definition, we understand that it's a systematic thing that's happening. And so when you take me back to 1896, I'm thinking post-Civil War. I'm thinking Reconstruction, post-Reconstruction. I'm thinking of Hiram Revels, Blanche K. Bruce, who were senators, U.S. senators, U.S. representatives at that time. And for 70 years after that, we didn't have one single person of color making the laws, making the rights, and getting in front of what's going on. So we have people who don't look like us, who don't experience things like us, making laws that will last for centuries.
Right.
And so that is the impact, the implications of what we're facing right now. So we're talking about something happening in an unjust way, which is a disparity and health disparity. We're talking about policies, laws that reflect justice. And that is what we're talking about. So when we look at today's environment happening around the country, we see that this Black Lives Movement matter, and I'm glad they didn't give up. Back a few years ago when they first made a splash, because first of all, it's not just about Black Lives Matter, the group, because we know our forefathers and foremothers have been fighting for a long time. About Fannie Lou Hamer, and when I give you Dr. Dorothy Irene Height or Mary McLeod Bethune, we know that our folks have been fighting. And W.B. Du Bois and my good brother over there, who was this arch friendly nemesis, Booker T. Washington. So we talk about that over the course of years. We are now fighting some injustices that are happening on the policy level. So what we're doing here in Baltimore is so powerful, what we're doing. We have a nearly all African-American or Black or person of color legislature. mayor. So we have an opportunity with 67% of African Americans in this city to start to address the real problems and the real crime of injustice around our health disparities. And so we came together and they passed the Healing City Act, which trains all of the agencies and provides ongoing technical assistance to the agencies to start to understand, listen, that this health disparity, the background and the context to it is historical discrimination. Exactly. So we have to address those things first. And I think that we're in a perfect environment for it. I'm excited about it. We're about to move this city forward in a way that we have never moved before, because we are the sum total of those who have put their blood, sweat, and tears into this city and to this nation to move us forward. And so for me, it really is addressing at the individual level, at the relationship level, at the community level, and at the policy level, and making sure all of them
come together.
Yeah.
Yes.
So I guess we can say amen, right?
Yeah, amen. That's what I said. Amen.
Well, what I would say is, I think people of non-color need to address the history of our predispositions of health. And what I mean by that is, we weren't given the good food when we were slaves. We were given the scraps. And as the generations passed, those scraps are still used in our diet today. They're not the same exact items, but that same cooking fat and shortening and everything else, it still presides. And why I say that, when I went to the doctor afterwards, a doctor asked me, he says, what is your family history? He said, I've had guys in here twice your size and have had no issues. And you've had a heart attack at 32. It's something in your family's history. So I'm already born. So go back to what Mr. Williams said, when we're born with so many implications, we're born with so much in our DNA to knock against us. It pains me when people still think that this Black Lives Matter means that we're better than somebody else. Exactly. It's just that we want to be as even across the field as you are. We want the same, but it's going to take centuries. And why I say that is because it took centuries to get to this point. So, as far as education, not just in health, but in banking,
everything, everything,
and everything. And there are generational families that have served in the Senate and politics. There are generations that are taking over banks and corporations. So how are we to catch up unless you all acknowledge that there is a deficit that we're trying to overcome? So to me, it's going to take an acceptance of people to understand that African Americans have dealt with so much. It's finally time to allow them the space to grow and stop keeping them down and ignoring the warning signs. Because when you ignore the warning signs, what you get is your Target and Walmart burned down because we're tired of it.
And so you guys you sound very passionate about what you do and what you believe in and what you're saying. So how do we start that change at the local level? I think most people think everything starts at the federal level. How do we start at the local level? How do we start in our communities? If we're saying that we're born, let's say with trauma or born into traumatic situations, and I'm gonna give you an example, a baby born into two parents that are addicted to drugs. Where do we start at? Where do we start when it comes to working with that particular child born into such a traumatic environment? Does this child, what's the survival rate coming out of an environment like that? We talk about resiliency a lot, and that's really good, particularly with some people, but there are people, we're not as strong as other people. So we have to kind of work through that. But at that local level, what do we need to do to start that change process? We're having this wonderful conversation today, and these conversations are great, but what do we need to do at an individual level, particularly within our communities, within our families, and start this ball to rolling when it comes to dealing with trauma, when it comes to dealing with health disparities itself, when it comes to looking at issues of literacy, when it comes to looking at food deserts, as you talked about, what do we need to do to start this, to start the change process? So
Yeah.
again, that we can look at 1896 and we can look at 2020. I think we talked a little bit about it, William, but where do we need to start if individuals are being born into traumatic situations?
So Dr. Williams, that really makes, because I was actually going to say this before you brought that question up, and you said resiliency. I always go back to definitions. The definition of resiliency is to the ability to bounce back from adversity. But I always ask a question past that definition to folks I always engage, and that is, what are we bouncing back to? What are we bouncing to? Be resilient all day, but you're bouncing back to the same neighborhood, bouncing back to the same family conditions, bouncing back to the same unemployment, bouncing back to these things. So they're real tragic. I even think you brought an example that I was going to bring up, which is I imagine a 5-year-old child who is has two parents, has a parent in a household. That parent is responsible for keeping that child safe and keeping the danger away, right? But what if that parent or that caregiver is also the person who brings the danger? How does that child grow up to be able to determine the inner warning signs, the flags that go off on danger and not danger, safety and not safe? How does it go off? And I can think about that with, even the social determinants of health, the conditions in which we live and grow and play, right? And just in a neighborhood, 21217 or 21215, for instance. And we didn't make all those conditions, as I think Brother Aaron said. We didn't make all these conditions. I mean, coming from slavery, you couldn't make any conditions except the ones you had your block. So we didn't make these conditions. So as individuals, though, there's a level of education that we should have. But what if we are not even exposed to any of that kind of situation? So that really takes community programming, voices, to be able to engage families, such as Roberta's House is doing a lot of that to engage. You're in your role as a nurse, you're doing that on every time.
Resources.
So I think that some of the things that our Commissioner of Health has said that are sort of strategies or interventions to really focus on what we can do at a local level is health in all policies, number one. Okay, health has got to be in all policies. And when I say that we're at the helm of changing legislation, laws, policies to reflect a healthy Baltimore 20 whatever, really looking at those health and policy, and to go upstream and work on prevention, because we spend less than 10% on prevention in the nation. So in this city, we have to spend more money on going upstream and honestly not be afraid to do it, because I think the budgets, I was just in the budget meetings recently, and we're sometimes we're just so anxious to go upstream and say, something, I'm gonna go ahead and put $50,000 more in prevention versus responding and reacting to the homicides, the fatalities. And very well, when we're having for every homicide, for every loss of life, even opioid overdose fatality, 7 to 10 people are directly impacted by that death. And that's the research. It shows that 7 to 10 people. So I think that it's important to really look at, again, the individual, community, and we all have to meet each other on the spectrum. And then our agencies, we have a large job to do as well. We are just as responsible as agencies, as systems, as institutions, for causing the barriers. And so we got to remove it at my level, in my space, Roberta House space, and the not-for-profit, the healthcare space in your space. And we got to, and we also have to treat people with dignity and respect as we meet human beings one to one.
I agree.
Exactly, I agree.
We have to be able to start really at that local level, particularly, when someone comes to you, Vicki, they're talking about, you may ask about the health itself and looking at the history of that particular person, whether or not the mother died of cancer, the father had hypertension. Are we asking the questions when it comes to trauma also? Are we asking questions on whether or not mother was a substance abuser, whether or not dad was incarcerated? Are we asking the literacy question? Because I think a lot of what happens also is that we have individuals that are coming in, and you're saying, fill this application out,
Mhm.
He can't read the application.
Well,
So we have so many places and so many, as Aaron said, and I always use this to also, that onion. You start to
right.
peel onion
Start to
back,
put
and we start to find out more and more. Once people start to trust you, they tell you a little
They'll
bit
tell you a
more,
little bit more.
and then you find yourself with that presenting problem. But there's so much more that's involved in this process. So, Vicki, you were going to say?
Yeah, I was going to say, well, good point, because we also do a social screening as well. Once the patient is diagnosed, and you will find that a lot of people will say, oh, I used to weigh, like dealing with hypertension and weight, as far as diabetes and weight. Oh, I used to weigh that. Oh my goodness, I remember, 5 years ago I was that weight, but now I'm this weight. And then you kind of get into, well, what happened? And so once you dig deep into it, it'll come out they had some type of trauma. And they ate this and they ate that because it got so good that would relieve their stress, or that would get the trauma off their mind, or the thing that happened off their mind. And then to the point where when it got so bad and they had to go to the doctors and were diagnosed with hypertension or diabetes or whatever it may have been, it's like it was the trauma within, but that's the only way they could bring it out. You see what I'm saying? Because they felt like, well, if I eat it away, it'll go away. Right. Some people, if I drink it away, alcoholism, if I drink it away, it'll go away. And people have deep root, like I think William said, that germ is embedded. They could have came from a household with a family, 2 addicts, and held on to it for years. And some people talk about it and some people don't. Some people wait till they get to a certain age and bring it all out and say, I never told anyone. So it can be a great number of things. And like, again, William said, that preventive measure, that's what we really got to get, bring around the full circle.
Exactly. So we need to spend more money into preventive measures, programs that prevent these things, and starting in schools, in elementary schools,
in school,
real early on. Aaron?
Yeah, Miss Vicki, what's funny with what you just said? Sometimes as a man, maybe women go through it too, but I'm just speaking from experience. Sometimes we'll be going through trauma and not even know it.
Right.
We're so used to going to the next day and getting through the next day that this is just life. Dr. Tillery, her many lessons to me that I've learned. Some people just live in chaos.
That's right.
And that's all they know. So therefore, they're living in this crazy world where somebody else on the outside looking in would go, how are you functioning through all of this? How are you still standing? But they're just so used to the constant moving and this getting cut off and this person want to fight. They're so used to it. They don't even know they're being traumatized. They don't even know they're traumatizing their children. If I see one more video where somebody's fighting and it's a 2-year-old in somebody's arms watching it, it's sad what we're doing to ourselves.
It's crazy.
As me and Mr. Williams said, we got the DNA giving us issues. And then we're adding issues onto ourselves by this chaotic spiral we're in. That how are we ever going to cut this off and not let it continue to 2040, 2050 if we don't deal with the issues here? That's why my thing with the whole protest is, what now? You want to abolish the police department? You want to defund them? You want this? I got you.
Okay.
But if that happens today, what are we doing tomorrow to help each other out? And I was having this argument on social media, and I had to disconnect myself. We're doing so much fighting about police, the police. What other policies do you know about that are affecting us? Do you know your homework on that?
That's right.
As you were saying, Ms. Vicki, you said the big R word, resources. Our social workers need resources. Our teachers, how many teachers are paying out of their pocket to help they don't get reimbursed, to help their students out? Then they got to worry about the students fighting them. And if they fight back in any kind of way, they're getting fired and losing their credibility as a teacher. How do you present to that teacher? How do you say to them, not only do I want you to deal with your stress, but when a 6-year-old comes in here and they're dirty and their clothing doesn't look right, I need you to talk to them and sit with them to go through what they're going through. How do you say that to a social worker who you don't want to hire an assistant because it's not in the budget. So now their caseload is double and triple. So they can't give their one-on-one time to it. But if they don't justify it in their notes because you didn't help them with their resources, then they get fired and lose their license. So as a professional, how can I really be there for a child if you, the system, the policy, if you, the state government agency, if you aren't supporting me, how can I do my job effectively and affect change?
Yeah.
Yes.
So I think we recognize that we have a lot of problems we need to work on, right? So it's not just, we will all agree that it's not just one particular problem.
Right.
I think we're in the situations where we want people to strive, but they're simply trying to survive. What Aaron was saying a little bit earlier was about dysfunction. People are functioning in the midst of pain, and it becomes normal to us. So how do we identify that? A lot of people don't know they're traumatized until you tell them. I've sat with individuals who lost someone.
Sometimes when you tell them, they reject it because they don't
believe it.
Well, a lot of it because they may not actually know, what trauma is. And we look at historical trauma, intergenerational trauma. So it's various forms of trauma. There's layers on layers of trauma. So we have a lot of issues that we need to address. I'm excited with you guys because you got passion and you're ready for this, right? It's like an army, a little army right here.
And
so go ahead.
No, and with me being in the health field, what we look for, because a lot of people don't say anything. We look for little things. If it's a consistent thing, if they're coming into the office, or if I'm going out to a home, it's just the little things you kind of pick up. Because I'm coming in from the outside, and I'm like, every time I go, he or she is doing X, Y, Z, and that's not normal. It's particularly when something's not normal. So as a nurse, you're writing down your notes and everything, and you bring it back to the doctor to say, you may want to address or bring this point up the next time, because this is what I observed, and that may contribute to what's, underlying.
So I think it's a part of too is taking personal accountability when we're working with individuals, to being able to see what people are not willing to talk about. And being able to confront those things sometimes that people are not willing to talk about. So this was a great conversation. I think we started something. So before we leave, I just want to ask each and every one of you your last word. What would you say to individuals that are struggling and trying to figure out, how do I survive in the midst of pandemic? How do I survive in the midst of so much social injustice, so much wrong that's happening in our communities? What would you leave with these individuals as far as how do we start that process, as I talked about, change? That's a big word, right, for a lot of people. How do we start that process with change? Let me start with Aaron.
Number one, and it's a great segue for the men's group that's talking on Wednesday. I hope you can join us at 6 o'clock. A big issue that men have, Black men have, accepting the help. When the help is presented, when the help is there, being able to be humble enough to say, yes, help carry me through this finish line. So I think being able to look at yourself, self-diagnose, do self-care, realizing that you want change. And then being able to say, okay, well, now how do I go about it? If we keep walking the same walk, nothing's ever going to change. So we have to be willing to recognize the change and be willing to understand that we do need to change.
Wonderful. Thank you, Aaron. Well said. William, and before you give us your last sayings, I have someone who have a question, one of our viewers. He says, do you see health disparities getting better or worse in the upcoming 5 years?
Well, thank you for the question. First of all, I see us with so much hope for a better future. We can do this. We have an opportunity here, as I said before, with a new incoming mayor. There's some energy going on in the city. And so we have a chance to address policy, real policy. And I think that, again, our health commissioner really touts that health in all policies is so key. So we're thinking about the Healing City Care Act that just passed. We're thinking about all of these things. And just a real point here, when I think about the disparity between the age difference in life expectancy, $10,000 more in your paycheck, in your family paycheck, can mean 3.4 years of added life expectancy. So does that tell you that the economics need to change in our communities? But you know something, so I think that yes, we will get there. I think we have a really great pathway to get there, which is health in all policies, and the health commissioner is really aiming toward that. I think concretely, we're still working on those things. In fact, at the health department, we're readjusting our strategy at this point. COVID-19 hit us right in the middle of our strategy planning. The commissioner had went on 9 community conversations, and she is, first of all, the first African-American woman to ever run the health department since the 1700s. It's the longest continuously operating health department in our nation, and we haven't had a Black woman yet. So it just gets to me that we have to get to that point. But she's very invigorated to be able to get there concretely. So we're adjusting our strategy. So keep an eye out for our strategy. You can also follow us on just put in Baltimore City Health Department on Twitter. You can follow us. And to that one word point, I think that I say trust is the first casualty of early abuse. Somewhere along the line, whether it was centuries ago or just as we're born into this world, something, not for all of us, but for some of us, we've had that trust broken. We've had that trust broken by somebody, some institution, some community member, something. And I think that building that trust and making healthy, positive connections with individuals and really going to these groups with Mr. Aaron and really talking it out, because that's one of the things we don't always do, is just talk it out. We need somebody to talk to, but we also need people who can listen to us, who won't say, you need to do this, you fix it by this. Because I believe I like person-centered, victim-centered, survivor-centered approach, where the captain of the ship is the person who is leading. Because when the lights are turned off and there's nobody right there, we're gonna have to have the strategy to be able to cope and get through. And I know just from my trauma as a childhood trauma survivor, witnessing my family get killed right in front of my face. I'm a witness to being able to cope through life, but also at this point, I'm actually doing something about it. I'm doing something about it. And I think that all of us have that power. All of us have that innate power. We just got to believe in each other enough. So yeah, we're going to get to 5 years of healthy Baltimore.
Yes, we are.
We're going to make it happen. But it's going to take all of us.
It's going to all of us, a community together.
Thank you, William. Vicki, what's your last words of hope for us, encouragement?
My last words, I'm going to piggyback off Aaron and William. They're right. Aaron, accepting change. You have to want to accept it. And it's hard for people in the community, especially with a lot of health disparities, to accept that change sometimes, because they feel as though, I'm good, I'll be okay, when really they aren't. So they have to accept the change and want to follow through. And the biggest thing is with the resources. If one is given a chance to get all the resources and all the knowledge that they can get, they have to really be strong and focusing on with following through. Because at the end, you're gonna be like, wow, it took me this amount, it took me all this time, and it was right here all of this time. It's right in front of you. So they have to be willing to follow through with the resources, I think. And it can be done, and you can do it. You can really do it. It can be done.
Well, I agree with everybody on this panel. You guys have been so passionate about what you do. I can tell that you love your job. I can tell that you guys are change agents and you're going to get it done, starting with one person, and that's you.
Yes.
So I want to thank you for the viewers for tuning in with us this evening. I also want to give a special thanks to Mr. William Caliber, Vicki Jones, and Mr. Aaron Kraken, and look forward to Aaron coming up this Wednesday. So we're excited. We started this conversation, and I'm the type of person, if we start something, we need to finish it. We will keep these type of conversations going. So join me next Wednesday, where I will be working with Ms. Lori Brunson, and she's going to come in and talk about nutrition. She's going to talk about the health disparities as it relates to some of the food deserts that Aaron was talking about. And she's going to share some interesting nutritional factors with us, particularly as it relates to African Americans and serving the urban population. So with that said, I want to say again, we're still in the middle of a pandemic. You still must wear your mask, right?
Yes,
Still
please
must
do,
take
please do,
precautions,
please.
right? You know,
Yes.
social distancing are very important. We are still number one in being impacted by COVID-19. So I want to say stay safe, take care of yourself and take care of your families. Most of all, pick up the phone, give those persons that are sick or elderly, give them a phone call, those people that you haven't seen in a while. And most of all, understand that the healing process starts within and it starts with you. So
Yes.
thank you again for
Thank you.
joining
Thank you for
us.
having us.
Thank you again. A special thank you to my panel. And have a
Thank you.
wonderful
Thanks for joining us.
evening.
Thank you.
Yes.